I want to welcome you to the 8th Annual World CME and Disparities Impacting Global and Local Populations Conference. This is being jointly sponsored by Healthfirst, MediNova, SUNY Downstate, my alma mater, and Howard University, College of Pharmacy of Continuing Professional Education. I'm Dr. Karen Costley, AVP Medical Director at Healthfirst, and it's a pleasure to have you all here. Happy to see you. Little background, over the past 8 years, the World Health CME has offered a chance for dedicated healthcare professionals and medical students, like some of you here, to commit to the work of advancing health equity, both locally and globally. In a city as diverse as New York, we are often reminded that global health is not just confined to distant countries. It lives in the communities we serve. New York is home to individuals from every corner of the globe, many of whom face barriers to accessing care, whether due to language, socioeconomic status, immigration status, ever present, or cultural differences. Vulnerable populations often bear the greatest burden of disease and often lack access to resources and support to the services they need. As healthcare professionals, we're uniquely positioned to be a part of the solution. This means delivering care that's not only clinically excellent, but also equitable and culturally responsive, and to make sure that we speak up when we see inequities in the system. We're honored to be joined today by leaders in the global health field, and we look forward to their engaging presentations and discussions. On behalf of Healthfirst, we thank you again for being here, and I'd now like to introduce my co-course director, Dr. Henry Paul, to say a quick welcome and to share more.
Good morning. I'm Dr. Henry Paul. I'm a nephrologist here at SUNY Downstate and also a co-director of this event today. I'd like to take this opportunity to thank our partners, Howard University, Healthfirst, SUNY Downstate, for being very loyal and sticking with us for 8 years during this conference. MediNova, I'm the president of MediNova. We're a nonprofit organization working mostly in Haiti. We do medical missions. We've been to the Bahamas, the Dominican Republic, most recently Jamaica. And we also have a clinic that we are managing and running on the northeastern part of Haiti. So our mission is to provide quality healthcare to the underserved in that country. And we are always recruiting for physicians, nurses to accompany us on our events. So with that said, I'd like to introduce one of our partners, a very dear friend, Dr. McDonald-Pinkett, to come and say a few words.
Good morning, everyone, and welcome to our conference today. It is certainly lovely to see you all, and I appreciate being in Brooklyn. A little different, but we're glad to be here. I'm Shelly McDonald-Pinkett, faculty in the Department of Medicine at Howard University College of Medicine. I don't think I need to tell you who Howard is, so I won't, but just know that we are always interested in global health, the interest of our nation, and the interest of all of those in the communities that we serve. Today we have a very special group of people who will be presenting their information and global experts, and we're so pleased to be a part of that conference material. My job now is to introduce to you Dr. Moro Salifu. And Dr. Salifu, would you please come forward?
Good morning to all of you. Let's do it the Brooklyn way. Good morning. Very nice. First of all, I'd like to acknowledge Dr. Costley. You said you're an alumnus of the College of Medicine at Downstate. Wow, that's that's very nice. So welcome home. Yeah, and congratulations on your new position. I also want to acknowledge the partners, Healthfirst and MediNova, Howard University, for this outstanding long-term program that they've been putting together for many, many years on global health, addressing so many topics, and also providing real-time care to patients abroad in Haiti and other countries. And I was lucky to be part of one of the medical missions in Cap Haitian. It was just remarkable what it meant to be part of that process. People don't just have the health care, and they're just struggling. Medical students, it's just amazing what you can do just with your presence, even without doing anything. Just the motivation of someone looking at you and say, wow, I can be something, was really something. So I was very, very impressed. I'd like to bring greetings from the College of Medicine. Again, yesterday was a big day at Downstate. The governor approved $1.1 billion to renovate and build new systems at the University Hospital at Downstate. So we're looking forward to, when you talk about global health, I think when you walk on Clarkson Avenue, you see how global this university is, right? You see everybody from various walks of life and basically from a lot of countries around us. As a matter of fact, a block from here is called Little Caribbean. That is the community. It's called Little Caribbean. So to be able to, provide funding to that level, to make the hospital, to modernize it, and to revitalize it for the service of this community, and to support the academic mission of the university is really, really something that the community really deserves, needed, and the governor just delivered so well. And so that was really, really very good news for the hospital and for our president, the dean, and everybody else. So I'd like to welcome you on behalf of SUNY Downstate to this conference. It's a very important conference addressing various kinds of topics. Some of you have come from far, you've traveled, and I hope that you'll enjoy the conference and be able to get home safely as well. There are some few, announcements I want to make, some housekeeping stuff I want to make. For those of you online, please utilize the chat feature on the Zoom to post your questions for the panelists anytime during the conference. We would like the panelists to come at the end of each of the sessions, and then we'll take questions. We'll hold the questions until that panel is finished. They will all come, and then you can ask your questions. And for those of you in person, there was supposed to be a booklet, but there's some issue. But you get a booklet very soon. The agenda is in the booklet when you get it. Just follow the agenda, and then you'll be able to see who's speaking and who's not. But you would get that anyway from the moderators who will be introducing each speaker quite well. There are going to be scheduled breaks. We have 4 sessions. So each of them takes about 2.5 hours. Then there will be the panel, question and answers, then a break. They will come back after the 4 sessions, then we close. Okay, now for CME, this activity has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education through the joint providership of the SUNY Downstate Health Sciences University and Healthfirst. So the CME is actually coming from SUNY Downstate. SUNY Downstate designates this educational activity for a maximum of 6.7 AMA Category 1 credits, so CME, each one of them, each hour is 1 credit. At the conclusion of the conference, you will have a link to do an evaluation, which is usual. After the evaluation, you're going to get your CME credits. Make sure that you have checked at the registration desk outside the foyer if you have not done so, to make sure that your registration is completed, because we're going to be looking at the registrations and matching that with your CME requests, right? For pharmacy credits, we are pleased to offer CE credits for pharmacists again this year. So if you're a pharmacist, you're going to get credits. Howard University College of Pharmacy is accredited by the Accreditation Council for Pharmacy Education as a provider of continuing pharmacy education. The program meets ACPE criteria for pharmacists. The education credits will be awarded through the CPE monitor within 3 to 4 weeks of the seminar. So expect to get that within a month after this event. Each of the educational activity will be shared electronically after the conference has concluded, and the deadline to claim your CE is August 1st. So please make sure that by August 1st, we have your request for CME or CE credits. All right, so that is that from me. So now I would like to invite back to the podium Dr. McDonald-Pinkett to introduce the first panel. Speakers, please be as brief as possible. We don't want to overrun the time. The questions and answer session, please ask your questions succinctly so that we can get, like on-target answers to the questions, and so that we can run the sessions more effectively.